Today, this is the final hour of our Friday edition here on eNCA, DSTV Channel 43 with me, Dan Moyane. Thanks for joining us. Now, digging Hammanskraal out of its water crisis hinges on getting the Rooiwal Wastewater Treatment Plant up and running. But at Tshwane MMC for Utilities and Operations, Themba Fosi says this could take years. Government is looking for 4 billion rand in order to complete the critical project in an area that's seen the worst of the ongoing cholera outbreak. Work at the plant stalled due to financial constraints. Now, these delays come as 11 new cholera cases have been confirmed over the last 24 hours, 10 of them in Gauteng, one of them in Northwest Province. Let's get more details now with my colleague, Pule Letshwiti-Jones, who's been tracking this story for us today. Good afternoon, Pule. Welcome to today. Thank you very much for your time. So what are you hearing? What's the latest from the National Health Department about this cholera outbreak?
What a week it's been, Bredan. I can tell you. I've been, in various areas in Hammanskraal, some of which I didn't even know about. And of course, this comes in just after the health minister said 11 new confirmed cases, 10 in Tshwane, 1 in the Northwest. Government is saying they're doing all they can to try and contain this deadly illness. You'd remember Ganana was the epicenter in Hammanskraal, where there were makeshift tents which were built to try and ensure that residents can go there and seek medical attention, not to put strain on the Jubilee District Hospital, which is already being seeing a lot of patients who are, of course, crying foul due to the cholera, disease as well. But what we also understand is that there's a bit of a confusion as to where the contamination came from. The minister saying that it probably would have come from someone who was out of the country coming or arriving into the country. But the city of Tshwane says, look, we can't confirm yet. We're still running tests. Once the tests are out, we will then reveal the outcome of what's going on. So we're still waiting for the source of contamination. But what I can say is that we've seen a steady, improvement in terms of the cases going down a bit.
Yeah, there's a decline.
There's a decline in the cases in the numbers, as well. Yes. I'd spoken to the Gauteng EMS as well. They've been on the ground. And the EMS service is saying that they're doing all they can to try and ensure that they get to the houses quickly. Now, what could be a problem here is the issue of load shedding. Sometimes residents cannot call due to bad signal, and therefore they have to drive to these hospitals as well, which is causing a bit of an upset as well in the community. But with the tents being built in the epicenter, of course, being Ganana in Hammanskraal, there seems to be a bit of improvement as well. Government had, of course, pledged to say that they will be adding more facilities, more doctors, more medical professionals to ensure that they fight the spread. I was in the Northwest as well, just recently. There, MEC Mr. Samadota saying that they are trying by all means to contain this virus as well. They've already been ready where they have built other temporary facilities to ensure that they can get up to points and dealing with this. They are on high alert. But there's a bit of a confusion I need to clear here, Dan. You'd remember the Department of Health in the Northwest had said that they'd confirmed about 2 cases.
Yes.
But they then retracted to say there is no one who has the case. So it seems as though the person who was living in a place called Moratele, just on the borderline of Tshwane and the Northwest, had tested in Gauteng but lives in the Northwest, and that's where the technicality then came. So it's very important that government gets their communication structures very right, because it can cause a bit of confusion in public as well. But let's listen to what the minister had to say.
There are still new cases. Even as of this morning, we still received the report from the NICD that there were new cases. In the last 24 hours, I'm just looking quickly at the report, there were 11 cases reported through laboratory confirmation, of which 10 in Gauteng, still in the Tshwane area, and 1 report in the Northwest. So there are still 11 cases new in the last 24 hours.
Okay, there's a clarity there about these new cases. But the numbers, as you said, Pule, have come down. Yeah. And the minister did confirm as well that the numbers are coming down, but we're not out of the woods yet, yes, as far as cholera is concerned. You were on the ground as well earlier today in terms of checking out what's happening with the water treatment plants in Tshwane. What did you see?
So today was more of a tour where I would then educate, to like actually tell a message to the public as well. So the problem is the Rooiwal plant, Bredan. It's problematic. It's stalled because of financial constraints, you know, as well.
Its improvement has stalled.
Yes, its improvement has stalled. Phase 1 of it has stalled. The municipality needs about 4 billion to try and fix the plant. They have already pledged around 450 million. So what's happening currently right now is that it's affecting the Themba water waste plant, which is the one responsible for distributing water to the households in Hammanskraal. Now, what then you get is that the plant in Rooiwal distributes water which is contaminated to the Themba purification plant, which becomes a bit problematic for it to function and essentially turn that water into clean, consumable
safe and drinkable water. Yes.
So that water can only be used for plants, for other things, but not for drinking. And therefore, in order for Themba plant to work, you need to then fix the Rooiwal plant, which is what the MMC says may take years, Bredan. But they're saying they will be looking at instituting an alternative plan by March next year, which would see residents in Hammanskraal getting water. But when asked about the issue of water tankers, it seems as though that may still continue, which many residents have warned and alleged that has been quite problematic in terms of many of the councillors in the area fighting over the issue of contracts and water tanks, which has been quite problematic. But the municipality is saying we will put the people first before tenders and contracts. Let's take a listen to what the MMC had to say.
Water from then on, obviously there's things that you and me cannot see with our naked eye, which are those microbes, germs and all of those things. They need to be cleaned and released into a pipe all the way through the river up until to Themba Wastewater Treatment Plant. Now, when you get here, it is only water. Now, this is where we purify our water for our people to be able to ingest it. This is the importance of making sure that this works, but this won't work when the first filter, which is Rooiwal Wastewater Treatment Plant, is not sorted out. So it starts there, and then it comes here, and then eventually to our residents. They can be able to access it through their communal taps.
Thank you very much to Pule Letshwiti-Jones there. An update on what's happening on the ground in Hammanskraal. We're not out of the woods yet, according to the health minister. There were 11 new cases of cholera recorded over the last 24 hours, according to the NICD. 10 of them still in the area of Tshwane, 1 in the northwest. But the numbers are declining. Let's hope sooner we'll be out of this outbreak in the country. Now,